So that is a very look at nature that would be very calming, right, and give you the resources. Of course, there are the various more specialized type of practices one can do in terms of lifestyle, like a type of meditation you can do, and we have a specific meditation like you mentioned mindfulness, right? But we have one where you can check in with your various selves. All right, so we have a different selves, and I believe Lava, you should have this book, Embracing Ourselves, which is the first book you read when you come here. Show that book, please. All right. So this is a book by Houston, which who's a Jungian analyst, and the idea is that we have different selves, right? We have a self that are confident, we have a self that is fearful, right? We have a self that is vulnerable. So this meditation involved in checking with each of the self. So so say you have a co-host event this afternoon. So when you wake up, you check in. How's my vulnerable self doing? How's my fearful self? I may even have a panicky self. How's that doing? Well, it's more like a vulnerable self, right? My vulnerable self, how is that doing? And then tell her or him that your resourceful self is there. I got your back. All right. So these are all nice psychological lifestyle practices you can do as well. Okay, you found my book. Fantastic, Lava. Embracing Ourselves by Houston. And I learned this technique from his daughter, Tama Stone. Right. So this is the Jungian type of therapy called voice dialogue, which we also have in the course as well. Very useful. Right. I think that there's a lot in terms of lifestyle changes. We can practice good lifestyle change, good lifestyle that would help us, and of course, work-life balance. We don't want to be having what we call the unrelenting standard type of schema. Trying to do everything perfectly, which will also lead to a panic. Right. So maybe there's something we can also talk about later, the various schema or psychological program, and Lava, you can try to get hold of some schema card like vulnerability to harm, right? Card and things like that to prepare us. Yeah. Exactly. So I've alerted you to the fact, that the symptom might be very similar to say a heart attack, right? So in which case you would need to check out whether there is a cardiovascular disease or not. At IPC we do have a lab that tests for such things, right?
Okay.
So that's a test. Not just your normal cholesterol test, right? We have a stress test, for example, right? We have a cortisol. Of course, when you have a panic, right, your cortisol level will increase. So that will not differentiate. But you can test whether there's a clogging of your heart, right? You can do an ultrasound. You can, for this you might need to see your medical doctor to do that. Right, whether there's an actual heart disease event or not. So you need to rule that out, right? So IPC, I mentioned we have something called LDL subtraction test, right? With our sister lab, to do that. So they look at the size of your lipoprotein called LDL, right? This is like your a type of cholesterol. If they are like small and dense, then that means your arteries are clogged up, and this is associated with a heart disease, right? So this is one way you can you can do, but you might need to work with a medical doctor for that. Right. So in IPC, of course, you need to first of all make an appointment, and someone, either a psychologist or psychiatrist or a therapist, will do an initial assessment to see whether you indeed have a panic attack, or you just have heartburn or some heart disease coming up. So that needs to be assessed, and then if it is true you have a panic attack, then we will do the CAS formulation, which our students have all learned. What is the underlying causes for the panic attack, right? Whether it is a relationship problem, having the breakup, the wife say they want to leave him and then panicking, the threat that they perceive, whether this is realistic or not, looking at the underlying causes, whether the person has anorexia that leads to panic, right? So step by step, we uncover the underlying causes and then treat accordingly, whether through CBT, mindfulness, other type of therapy. We have many type of therapy, art therapy, even music therapy, all helps, right? And of course, there's a physical side of things, lifestyle changes, psychiatric medication if needed, psychonutritional medication. All these are available. You can even do a neurotransmitter test to see whether you have too much dopamine, not enough serotonin, right? To all add in. So we believe in holistic treatment. In IPC, looking at all the jigsaw to treat effectively the whole person rather than just treating the symptom, right? Panic attack is very treatable, very reversible, very preventable, right? So that is the message we want to give out to people. But there is, of course, underlying causes. The imprints can be traced back to childhood, right? In a lot of cases, and this schema that we mentioned, vulnerability to harm, can be changed, right? Just like your computer program, you can install a new OS, you can get an update, right? So instead of vulnerability to harm, we can get an updated schema, right? A healthy, good enough, good enough standard schema instead of vulnerability to harm schema, for example, right? So we have therapy called schema therapy to do that as well, which is a form of CBT. So yes, this is how IPC can help, and of course we have a lot of wonderful courses that can train students on how to use all these skills to help more people as well. Totally. So the because the panic attack, the symptom is essentially the physiological response. Okay, so we were talking about stress, right?
Mm-hmm.
Yeah, talking about stress. So stress has a physical symptom component, just like we mentioned just now. I started with asking Kaushini, how does she feel? Does she feel excited or does she feel panicky? So there is a certain physical sensation. Our heart rate raise when you feel excited and we feel panic. It can potentially be very similar, right? That is increased heart rate for sure, right? And then maybe even sweatiness, right? So patients, people need to be educated on the physical component of stress. That stress, the physical component of stress, is not necessarily negative, right? So it goes back to CBD, the story we tell ourselves, right? So there's something called stress inducing mindset. But anyway, the idea behind this is there are subjects, right? Again, the experiment divided into two groups. One group they are told that the stress is good for you. You do this thing, you will feel your heart rate increasing, and this is all beneficial. It lead to you to learn better, perform better. Another group was told stress is bad, right? You have all this increased heart rate and everything. You lead to negative effect on your health. And guess what? You look at the performance of these two groups. Before their performance, the same performance, they given these two different story, right? The two different stories, of course, are all true. Stress can be good and stress can be bad. But the group that were told that stress is positive perform much better, right? So this is called stress as an inducing mindset. It's beyond growth mindset, right? Okay. So yes, the physical components itself is neither here nor there. It's how we interpret it. Sorry, we feel I'm feeling heart pounding. This is a good thing. This is a positive thing. It's going to help me perform better. Or you tell yourself, this is bad. I'm going to like collapse and die or something or faint, right? Then you're going to have a panic attack. So again, this is all amenable to CBT treatment to teach the patient to have the right type of mindset, the right type of story to tell. Yeah, so the question is whether a panic attack is secondary or primary. It depends. But of course, it's always secondary in the sense that the underlying cause is a schema or a physical issue, right? Of heart attack or stress hormone. But then the question, what is causing the high stress hormone, right? So. So it could be a psychological, always going back to the psychological interpretation, right? Of a situation. So in that sense, you are right. It is the DSM-5 is always just giving you the presenting problem, not the underlying problem. They give you a list of criteria, 11 criteria. All these are just symptoms. It doesn't tell you anything of what is causing, right? The symptom. For that, we need to do a full case formulation, which you guys have learned during your classes, and hopefully you can. We can only treat effectively. We treat the underlying causes, not at the symptom level. Okay.